Alright everyone, today we're going to talk a little bit more about headaches and some of the different types of headaches, how they may present, and how you may want to address each of those. So in general, headaches I kind of break down into three different categories. Category number one, we have MSK, which stands for musculoskeletal, migraines, and our scary dairy ones. MSK headaches are by far the most common types of headaches. And MSK headaches are essentially headaches due to either the muscles or the joints around your head and neck area. We have two types. Type number one is tension type headache. Tension type headaches occur when there is muscular dysfunction around the head and neck area. When this muscular dysfunction occurs, it can cause a direct pain referral into some parts of your head. This can include muscles like along in the front here, called your sternocleidomastoid or your SEM, or along the back of your neck, called your upper trapezius, or muscles including your splenius capitis and your splenius cervicis. If we're looking at cervicogenic headaches, this is a little bit more specific in the head and neck area. This occurs when the joints directly at the top of your head, your C1 and C2 joints, become a little bit stuck. This causes pain referral into your head because there are nerves that exit your spine at that level that end up traveling all the way around your head. That can get interfered with due to that joint dysfunction, causing that headache. Nerves are just blood-filled pressurized tubes, and they don't like it when their blood flow is disturbed at all. So if that joint around the top of your head and neck area can get a little bit disturbed, that can cause inflammation, and inflammation can cause chemical irritation of a nerve, which can result in that headache. Next, we have migraines. Migraines are a little bit of a different beast. They don't really fall into the MSK category. They're a little bit more of a neurological phenomenon. Research is actually still kind of out on what actually causes a migraine, but what we do know for sure is that migraines always have triggers. Common triggers can include chocolate, wine, and actually an extremely common trigger for a migraine headache can be a cervicogenic or a tension type headache. The presentation of these headaches can be a little bit different. Tension type headaches generally tend to be all the way around your head. They tend to be bilateral, they're quite dull, and they're quite achy. Cervicogenic headaches differ slightly. They tend to generally only be on one side of your head, again, dull and achy, sometimes causing pain to go behind the eyeball as well. The difference comes greatly when you get into this migraine area. Migraines really result in a pulsating type of headache. You feel like you have a heartbeat just going on in your head. Oftentimes you'll become very sensitive to bright lights or loud noises, and you will typically become nauseous and you might even vomit. These types of headaches occur, you kind of just want to hide into your dark room, turn off all the lights, turn off all the noises, and really just wait for this one to play itself out. Last but not least, we have the scary dairy ones. If you are experiencing a headache and all of a sudden you become dizzy or you start to see double, if you have trouble speaking, if you have trouble swallowing, that is something to be concerned about. And before you do anything else, it is best to actually go to the emergency room. All right, so if you're experiencing headaches that also include difficulty speaking, difficulty swallowing, any sort of dizziness or any sort of change to your vision where you're seeing double, that's where we get a little bit more concerned about some of the neurological or vascular aspects going around in your head and neck area. And those might actually be symptoms of a stroke that you're experiencing. So that would be, the exact perfect time to go to the emergency room to get those symptoms assessed. So, like I said, these are the three major categories of headaches that we see in the clinic. And moving forward, we'll talk a little bit more about how these might be assessed in a clinical setting.